Is your gut still waging war after a SIBO treatment or treatment for IBS? Maybe you hammered it with Xifaxan or herbal antimicrobials, but you still feel lousy or still feel there's a problem there. Well, you're not alone, and you're definitely not crazy. The hard truth many doctors miss, especially with SIBO or post-infectious IBS, is that treating it is rarely a one-and-done phenomenon. Hello and welcome. My name is Dr. Terranella, and this channel is all about helping you optimize and improve your health. Today, we're exposing why SIBO treatments often fail long-term and the critical steps and elements you need for lasting relief. All right, let's cut right to the chase. The number one reason your SIBO treatment actually failed long-term probably isn't that the Xifaxan or other antibiotics didn't work. It's that the job wasn't finished. Killing overgrowth of bacteria is just part one, and the absolute critical missing piece for most people, especially after this infection, is fixing the gut's slow motility waves, the migrating motor complex, also known as the MMC. And without stimulating this natural street sweeper function, those bacteria will basically find themselves right back where you eliminated them from. And this is basically like going into the garden and pulling some weeds, not all of them, but you didn't fix the soil and you also didn't stop new seeds from blowing in. Targeting the bacteria on the surface with that antibiotic allows the remnant microbes, whatever's left over, just to repopulate the same area you just removed them from. And so killing some of them isn't enough, especially if you don't fix the motility, because they're just going to come right back. Trying to figure out how to break this relapse cycle can sometimes feel impossible, and that's why I put together a couple courses on this. The main one is on post-infectious IBS, aka SIBO, to help you navigate what to do in certain situations. So let's unpack why that initial treatment plan probably failed, and like a temporary band-aid, why a one-and-done antimicrobial approach usually isn't going to be enough, and more so what a real recovery strategy should look like. So the biggest problem I see with treating SIBO and post-infectious IBS is a problem with the coordination and careful monitoring of progress. For instance, one round of rifaximin or even antimicrobial herbs is helpful in most cases, but it's just one round, and often a much longer, protracted battle is what's needed. You can think of one round as like one phase. Stopping the treatment or the battle after just 14 days is going to leave some leftover remnant weeds in that garden we call your digestive tract. Specifically, we're referring to your small intestine. And this may sound like a finer detail that maybe, isn't necessarily needed, but when it comes to your gut, the finer details do actually matter. And let me elaborate on this. Sometimes when people treat SIBO, and I see this in my practice as well, you may have noticed that there was some improvement after the treatment was over, maybe in the middle of the treatment, that lasted maybe a few days, maybe a few weeks, maybe even a few months. Why not longer? Why isn't there longer term relief occurring here? That's the question we want to ask and answer. Why didn't you get 100% relief after that one round of Xifaxan or one round of antimicrobial herbs? And the answer maybe is quite obvious, maybe it's not, but one thing that I think a lot of people overlook is just how massive the small intestine is. It's around 20 feet long, and so one round of Xifaxan or antimicrobial herbs is probably going to knock back or reduce some of that bacterial load, giving you some initial relief, but it's probably not going to get every single pocket of microbes that's there, especially in more severe cases, maybe methane-dominant SIBO, or for those with biofilms that are protecting those bugs. And that's where this idea of residual bacteria comes in. And in time, those leftover residual bugs, maybe in a few days, maybe in a few weeks, maybe in a few months, are going to start to multiply. And then bam, the bloating, cramping, pain, discomfort, diarrhea, all those problems come rushing back. And then you say to yourself, oh, that treatment didn't work. Well, actually it did work. You just didn't do the things that were going to keep it at bay, and you didn't follow up in appropriate time to continue to improve or to keep that microbial overgrowth in check. And so I wouldn't think about it as a treatment failure, but a treatment of incompletion. So you didn't get enough of the microbes gone to allow a complete resolution, which makes sense, right? If we're dealing with 20 feet of intestines, you need a small amount of bacteria in those 20 feet of intestines to create this problem. We think we have this huge issue that's going on because we feel it as such, but we have to understand too that a lot of times there's visceral hypersensitivity. meaning that it seems like a big issue in terms of the intensity of pain and discomfort, but it may just be a small little pocket of microbes in one small little area of your intestines that's creating such a large response, such a discomforting feeling. And sometimes you may have multiple small little pockets of these over that 20 feet of intestines. So sometimes treating SIBO or treating post-infectious IBS is really simple, and sometimes it's really complex. And I think we have to appreciate that this is like restoring a damaged ecosystem. It's not going to be like flipping a switch like most Western treatments are accustomed to. Yes, reducing the burden, the initial round of treatment should help some, at least a little bit, but it's only one part of the problem. And part of it is it's going to take time and multiple steps to get to that finish line or get to a place where you at least feel like somewhat okay, somewhat normal. Another thing that's important to recognize too is that killing the bugs or reducing the burden of bacterial overgrowth in the small intestine doesn't magically fix the damage that has occurred from those microbes. And so there may be issues with damage to the gut lining. There may be nerve issues linked to the, for instance, anti-insulin antibody, or other healing needs to take place in those mucous membranes or those nerves. So going back to the migrating motor complex, this is a really important one. Those gut nerves can be damaged by ongoing inflammation in the gut from the bacterial overgrowth. And so you're not getting that rhythmic cleansing of the digestive tract, which is also pushing out those microbes. And so if that's broken, it's going to be that much harder to keep these microbes at bay. And that allows them to just kind of migrate back to where they were and set up camp again. Killing the bugs doesn't heal the damage, but sometimes time does. And sometimes you need extra support to heal that damage, to calm down the immune system, to help encourage the mucous membranes to repair. Over time, generally speaking, that damage does start to heal, but we definitely need to give the body a chance to do that. And some people need much more support than others. Some people don't need hardly any. So feeling that out and understanding that, sometimes we need to do extra testing to understand that, or we can get some clues from symptoms as well. So the critical thing to remember is if you have post-infectious IBS or SIBO, or maybe you just have IBS, there's a good chance that there's some damage to your migrating motor complex, and that means it's going to have a much slower response. You're going to have less of that cleansing effect. And remember, the migrating motor complex is like a rhythmic movement of the nervous system, and it's an internal aspect of your digestive tract, and it's moving through and sweeping out the intestines in a rhythmic way. And it's not the same thing as having like a laxative effect. It's more happening in the small intestine, and it's a sweeping mechanism. And so if we don't take anything that's going to help engage that migrating motor complex, these are called prokinetics, those remnant microbes that are left over are going to be allowed to move around at will a lot more and basically start to replicate and refill any reduction in microbial count that we've done. So some examples of prokinetics are things like low-dose naltrexone, low-dose erythromycin, and there's also some specific herbal prokinetics too that we've used. There's some specific extracts of ginger, and I'll put a link to one that we use in the description. So these are going to help prevent those bacteria from moving around more freely. You can think of it as like an ocean kind of sweeping things away. And so it's important to note that bacteria don't just randomly regrow in your small intestine or grow in your small intestine to begin with. Something needs to allow that to happen. And a primary cause, especially with IBS or post-infection IBS, is from that migrating motor complex problem. Without those housekeeping waves, that downward pressure that's occurring, some people maybe are more susceptible to it to begin with, but that damage there is what sets you up for having IBS and bacterial overgrowth. And the other thing is sometimes people do take the antimicrobials and they follow it up with a prokinetic and they still have lingering symptoms, or they only got like 5 or 10% better. And why does that happen? Well, most often it's because the first round wasn't strong enough. It didn't kill the microbes there, or it only got rid of a small portion of them. And I would say that's probably the base case for most people. But other things could be that there's still damage in the intestines, and that damage is causing a lingering inflamed sensitivity there. And killing the bugs doesn't fix the damage, but a lot of times our bodies can heal that once those bugs are removed. But some people do need more support, like with L-glutamine or other herbal things that help support the mucous membranes. Sometimes it's not actually a SIBO issue, or you may have other microbial issues too, like fungal overgrowth or other microbes. like H. pylori or some kind of parasite. So understanding and testing helps us get clear on what actually is happening and which direction we need to go down. Sometimes the underlying inflammation can cause that visceral hypersensitivity that we were referring to earlier. That may need to be addressed separately too. It's sometimes related to inflammation or sometimes just time healing. There could also be a mast cell activation going on locally. And so sometimes we have to give separate attention to each problem, and we don't want to get too hyper-focused on just the gut. We'll sometimes need to take a step back and look at all of the things that are going on with each individual. And that's why it's important to follow up after your treatment with a knowledgeable practitioner that can help guide you through this process, especially in cases that you're not getting the full healing, the full optimization of your gut. And you'll know because it should feel dramatically better. If it's not, then you're probably missing something. So you need to find a doctor that definitely understands SIBO, post-infectious IBS, and these gut microbial overgrowth scenarios, leaky gut, all that stuff is important to understand to get to that optimal state. Sometimes you do need to repeat the test, whether it's a breath test or a stool test or some other testing to help triangulate what the problem, what the missing piece is. Oftentimes what I find is people just need another round of treatment and they need to make sure they're taking Prokinetics, or maybe they have more of a post-infectious IBS thing going on and there's specific tests you can do to identify that. And basically, the more information you have on what's going on, the more clear the treatment options are going to be or what you need to do to fix the problem. For sure, taking a prokinetic is non-negotiable for issues with post-infectious IBS and SIBO, and understanding that there's multiple layers or multiple phases that need to be integrated. You don't just keep taking antimicrobial herbs endlessly to fix these things. And same thing with antibiotics. If things aren't working, we need to step back and understand why it's not working. That's where testing comes in. So I want to make sure you understand that I do have a course on post-infectious IBS and SIBO that can probably help you navigate some of this and help you have a more detailed, nuanced conversation with your doctor as well. So I'll put a link to that in the description. The bottom line with SIBO and post-infectious IBS treatments, when they fail, it's probably because there was an incomplete treatment, meaning that there's still remnant microbes left over, not that you're untreatable or that the treatment didn't work. Killing the bacteria is one step, and sometimes you need to do that step multiple times in different phases. But you also have to recognize that there's several steps to each phase, which include healing, rest, diet, and sometimes other things. Last thing, relief requires a coordination of all these things. So hopefully this video helps you better understand why your IBS or SIBO treatments are not working or didn't work. If you have questions, please drop them in the comment section. If you want a more nuanced answer, consider joining the membership program. Now, sometimes people are not sure if they actually have SIBO based on the test that they did. And if you want to understand more about how to test for SIBO and what tests to do, you can find an answer to that in this video here.